Hey guys, what's up? If you're watching this video, you came here because you're looking for information about kidney stones. Now, if you're looking for information about kidney stones, you either are experiencing major pain and discomfort now, or you did, and you're doing your research, figuring out what to do, how to deal with it, and what the hell is it? Well, let me tell you, you're not alone. There's things that you could do. We got certain strategies that you could take to try to make this time go easier. And we're gonna ease your mind, letting you know that you're not alone. That, and no pun intended, but this difficult time with your kidney stones will pass, and hopefully the stone passes quickly for you. So I'm gonna overlay some video, probably some driving, probably some tennis, and we're gonna have a discussion. Now, this is a warning. I am not a doctor. I do not work in the healthcare field. These tips and tricks and this perspective about kidney stones is from my own personal experience and discussions and conversations I've had with other sufferers through the comment section in my first kidney stone video. There was a lot of good ideas. A lot of people answered questions that I even had about it that I didn't know. So since I built up that information, I want to put together this video to try to relay it in a more informative format. So if I was you, I would check out both videos in whatever order you like. But if you're armed with the right information, then this time will be much easier for you, and hopefully you could get, again, no pun intended, past this bad time. Let's start the conversation by going for a drive. Okay, guys, here we go. Number one thing is, once you realize that kidney stones is your issue, then you're going to need or want to know a few certain things about it. This way, you don't have to deal with the stress of the unknown. If you're armed with information and you get an idea of what your road and your journey with kidney stones and passing them is going to be like, I think it will make your experience a little bit easier. So, kidney stones form in the kidney. When they get loose, they come down the ureter. That is the tube from the kidney to the bladder. And then from the bladder, they pass through your urinary tract, through the ureter, and out into the toilet bowl or wherever you choose to urinate. So, depending on the size of the stone, you will either feel a sharp pain in your flank, in your back, either side. It could radiate in the general area, depending on the person. Feels like you're being stabbed with a knife. The pain comes on slowly as an ache and peaks to a pain that they describe as worse than labor. And I basically wound up boiling up and feeling like I wanted to die. Um, I go into my little story about that in my first video, which you should check out, link in the description. But it's painful. So, what happens? The stone, through gravity, works its way down into the ureter. There is usually the pain is caused when the stone is large enough to get stuck. And when it gets stuck, it causes a blockage of urine flow from the kidney. The kidney tends to swell up. When the kidney swells up, all those nerves in the kidney cause the pain. Your body is warning you that something is terribly wrong, and and if it stays stuck, which is a rare occurrence, it could cause kidney failure, which nobody wants. But most cases, it makes its way down, and then all of a sudden pain goes away, and you're wondering what the hell happened. Well, it made its way down through the ureter, and now it's in the bladder. So now it's in the bladder, and it's going to hang around in the bladder either the first few urines, or a few weeks, or a few months. There's no telling when that stone is going to be passed. It all depends on the size of the stone. Now, all stones are shaped differently. Sometimes they're clumps of different stones loosely formed together. It could be a large oval shaped stone, which it will only pass if conditions are right, that it falls on the narrow side in order to pass, and hopefully you have enough urine pressure to push that stone out when it's in the perfect position. And that's usually the tricky one. Right now I'm dealing with one that's doing just that. It's been about 2 months. I feel it in the bladder, and when it hits the right spot, I could feel it. It feels like a burn. It feels like a dull ache, and it feels like you have to go urinate immediately, even though you probably just emptied out 10 minutes before. Feels like you have to go full bore on again, and that's pretty frustrating. And forget about the anxiety of going out and being somewhere and having these feelings of, forget about it. So anyway, there's stone anxiety also. So when it passes your bladder and you urinate it out, what's going to happen? Usually it stays, usually it happens like this. You go to urinate, and hopefully you drink enough water that you have a good, strong flow. So all of a sudden you could be urinating, and then it's like someone turned off the spigot and you lost your flow. It could go down to a drip, but yet you still have the urge of going, but you can't. And that's because the stone is blocking the flow. So, in a perfect world, the stone should be blocked until a certain pressure is reached, and then you're able to push it through, and hopefully it goes through in one shot. I've had experience where it happened at the end of my flow, so I didn't have enough liquid to push it all the way through, so it stayed stuck until I was able to hydrate and have a full urination in order to make the stone continue to trip. And that was a pretty interesting day, to say the least. But when it passes, and when it's stuck, and when it's going to pass, it feels like a real, like if you got a urinary tract infection, that it burns. You could feel sharp pain. You could feel a dull ache. Definitely, you will know something is going on depending on the stone and depending how your body reacts to it and your pain threshold. Some people knocks them off their feet. Some people you have to ball up. Some people uh, kind of just bear and grin and pass it, and basically super relieved right after it's passed. Once it's passed, you might see a little blood. You might see a little, I guess, debris, a little blood clots coming out. That's because of the damage it did on the way out. If the stone is really jagged and really big, it could do a little bit of scraping and scratching on the way out, and you could get red looking urine, dark looking urine, that's blood in the urine. Don't panic. Or it could really look like Kool-Aid, red paint coming out. I've had those situations. It's a little shocking to see that, but it clears up if you drink fluid and continue to urinate it'll go back to normal once your body heals. So once you pass your stone, you'll have this huge feeling of relief, and your urine should clear up of the blood after a couple hours, maybe a day, and you should be back to normal, except for the fact that you're pretty much traumatized and wondering, is it going to happen again? Well, chances are, probably yes. Some people are lucky enough to pass one stone and never have to deal with it again. Some people are stone factories like me, which pass several stones a year. So this is just the way some people are built. They don't really, they could say dehydration is the cause, certain foods, dark sodas and liquid, coffee. You could read up all on the research, but I think it's just the way you're built, and that's just that. I guess if you eat smart, drink smart, you could probably cut down on your activity, but I don't see any science that's pretty solid on that. Now, someone asked me once, I showed and demonstrated the pinch method in my first video, and someone commented that she's a woman and she can't do the pinch method. So what can she do? Well, all the pinch method does is block the flow of urine, and in theory, it loosens up or expands the tube. Hopefully, it'll let a bigger stone get ready to exit, and then when you release the flow of urine, it's a powerful flow that ensues, and hopefully it technically blasts the stone out by delaying and preventing the urine, or you're causing the urine to back up and create an extra force that wouldn't be there if you weren't doing the pinch or blocking. Now, women, I assume you could go and just block the urine when you have to go and create that back pressure, and try to do the pinch technique or the blocking technique. And another tip for women is ask your doctor for Flomax. See, Flomax is a medication for men. It helps with urine flow due to enlarged prostates. Women don't have that, so doctors do not prescribe Flomax to women unless you're suffering through kidney stones and you need the extra help from Flomax. It will help you to some extent, and the side effects will help you pass a stone. So, from the comment section, I've had women tell me that yes, their doctor did prescribe Flomax to them as a woman because it helped in the passage of kidney stones. So, make sure you tell your doctor that even though you're a woman, that Flomax could help you pass the stone. Painkillers, if I ever got a prescription of some good painkillers, I always keep extra, because if you're a stone maker, you know you're going to have a painful situations every now and you could kind of feel it coming on, because you're going to recognize that pain right away, and that's when I jump on a painkiller. I start loading up on liquids, and I take my Flomax and basically try to deal with the situation as quickly as possible, throwing all the techniques at once, because I don't want to be dealing with this for days, for weeks, or for months. So that's kind of my strategy for dealing with an episode of of kidney stone pain. As far as surgeries, um, if you go to your urologist, you go to a doctor, a urologist, they make money when they do surgeries. Now, depending on the size of the stone, make sure that it's a size that's going to give you a hard time to pass. Because if it's not going to give you a hard time to pass, if you're just going to suffer, I would avoid surgery and leave it as a true last resort. Because too many surgeries, or the surgery is going to be expensive and it's going to be a pain. I mean, there's no doubt about it. Everybody would like to avoid surgery. So don't let your doctor be too quick to put you in the surgery room, because sometimes they get stones and they see stones up in the kidney that might not come down for a few years, and they want to go in there and clean you out, um, when those kidneys will come down when they please, and you'll never know. So it's up to you. You weigh the course. If I got 5 stones in one kidney that aren't bothering me, then I am not gonna go actively jump on a surgery table and clean myself out, because chances are, if you got 5 stones up there, chances are in a few years you're gonna have 5 more. You know, so that's up to you and your doctor and your personal choice of about surgery. But I think most surgeries could probably be avoided, or just really be armed with information before you just say yes to your doctor. Ask him if there's an alternative. Um, if you could wait to see if you could pass them on your own, as long as it's not a dangerous blockage, or as long as you're not in severe pain at the moment. Most times you could pass them depending on the size. Then again, I'm not a doctor. I do not work in the healthcare field. This is just from my personal experience and my theory and what I've noticed from speaking to many people about this, even doctors. Now, kidney stones could be seen through a coarse CAT scan. It could be seen through an X-ray. That's where I seen my stones, and I also had stones seen through a sonogram. They can estimate the size of the stone through those methods. Is it exact science? I'm sure they get it close. Last time I did that was about 10 years ago. So I'm sure CAT scan technology, X-ray technology, and sonogram technology got way better in the last 10 years, and they should be more accurate. Now, someone in the comments mentioned that if the stone is uric acid, he says an X-ray won't see it, and you need an ultrasound. So he recommends tell your doctor that you want X-rays and an ultrasound, which is probably a good idea. So I can't confirm that, but that is from one of the people who commented, and it sounds logical. Now, people say they drink certain drinks. One guy suggested that he drinks watermelon, and eats watermelons. He says it's like an IV, timed release fluid. Sounds delicious. Also, I've been using a Peruvian natural extract called Stone Crusher. I got it off Amazon. I'm not trying to sell anything. They claim that certain herb affects, releases bile from your liver, and it creates sort of lubricant so that the stone would pass easier. Some people claim it wears down their stone, uh, hence the name Stone Crusher. I've taken it. It comes in a pill form. I've also seen a liquid drop form that you mix with water. I can't say for sure that that works, but if you're in pain and you got rocks in you and you're desperate, I'm taking those pills once in a while, hoping that maybe there's some truth behind it. But I cannot say for 100% that I can point to an example of I drank the pills and I passed the stone or my stone disappeared. But if I think it's better than doing nothing. And if you're in pain and you got this condition, you might as well try everything. So I'm taking it now and then, hopefully to see if I could deal with this current stone I'm dealing with, which is a real pain in the butt. So age range in the comments, it seems to be from people from 18 years old to people in their 40s, 50s. I know men and women. Men probably tend to have a tougher time from what I've noticed through my conversations, but women have a bad time just as well. I know one woman who, every time it happens to her, which seems to be like once every 2 years, winds up in the hospital for a couple days with IV and pain medication and the works until she passes. I don't know if she's ever had surgery, but some people just get the pain, they ball up, hour, 2 hours later, pain goes away, then they pass a stone a few days later, and they're good to go. Now, as far as lifestyle, you have to be active. If you have issues with stones, it's best to get them shook and passed before they get bigger. This means you have to run a little bit. If you don't do any sports, the least you could do once in a while is do some vigorous jumping jacks on a hard surface, and you're basically going to shake the stones out of you. Now, do you want to go messing and shaking things that are up in your kidney and causing trouble? Well, if you already passed a few stones, you might as well just accept the fact that you will pass more. So, would you rather pass them when they get too big, or would you rather pass them when they're small? To me, I try to keep an active lifestyle, not only because it's good for you, but because it helps me with my stones. I play tennis 2, 3 times a week, and I just don't hit the ball and walk around the court. I go all out. So I'm shaking up my stones there. I used to own a boat, so when I used to go on a choppy day and the boat used to smack waves and take a pounding on some rough water days, I would go home and sometimes I pass a stone that night. So that tells me that shaking your body, uh, taking big hits and jolts will shake up stones that are on the verge of coming loose, and they will work their way down, and you will pass stones. That's one thing I'm certain of. So being active, drinking a lot of water, and and being prepared with Flomax and even some beer will help you. Um, Painkiller, and you could try those herbs, uh, Stone Crusher, but these are some of the strategies that I use, and you are not alone in your suffering. And hopefully, this eases your stone anxiety. Uh, at first, I was afraid to go certain places thinking I was going to suffer an episode in public or away from the house, and that would have been a difficult situation. But as you learn to live with it, and if you know your symptoms, you could time yourself to avoid going out and doing something if you're on the verge of an attack. But this happens far and few between, so you shouldn't have too much anxiety and worry about it once you start to recognize the symptoms. So, if you like this video and found any of the information useful to you, I'd like you to please subscribe, hit the like button, and help support this channel and help me spread the message of kidney stones. And I also have other videos of other things that I do, and I hope you check them out and ask questions in the comment section. I'm usually on point with answering them right away. And let's keep the positive information about stones going, and we could help you, you could help me, and we could help some more people down the road. Thank you, and see you later.